Hi, so have you heard about estrogen cream as opposed to the patches and the gels? Well, estrogen cream is a form of transdermal estrogen. So let's talk about that for a moment. I'm Dr. G, Specialist Medical Doctor and PhD in Midlife Moments Hormones, and this is my book. I talk about all the creams and the gels, etc. in my book and all the forms of estrogen that go into these preparations. So estrogen cream is a product that's usually, almost always made up by a compound pharmacist. Now they use the same estrogen or estradiol that is put into the patches and the gels. So the same estrogen that you're putting in a patch or you're using in a patch or using in a gel is used by a compound pharmacist to put into the cream. So it's the same sort of estrogen. Now where the creams differed in the past was that they usually had two or three forms of estrogen. So they had estradiol, then they had estrone and estriol. But more commonly now, compounders are just using the estradiol. So the creams became popular when all women had was the tablets. And some of the estrogens in the tablets, a lot of them came from mares, came from pregnant mares. Now, if you look up the mare farms, you never want to have a horse estrogen again, because it's not humane. It was what we do to horses when we get estrogen from their urine. Anyway, so nowadays compounded creams are not so much called bioidentical. They're just compounded estradiol, and they're very similar to, well, it is the same estrogen as what it is in the patch and the gels. Now, why would a person want a cream versus the patch or the gel? Well, I do prescribe some of the compounded creams, and I do so because some women can't tolerate the patches. They've got an itch, they've got rashes, and in some women I need to individualize the doses, believe it or not. I have a lot of women who've got multiple chemical sensitivities, they have mast cell disorders, and they really need smaller doses to start off with, or they just can't tolerate anything but some of these very nice creams that the compounders use. So there are various reasons why you might use a compounded cream, but take note that most doctors don't prescribe the compounded creams. They're not recommended, but they're not generally recommended, and they don't know how to prescribe them. So talk to your doctor about if you cannot tolerate the patches or the gels, because you might be a lady that wants a cream. Okay, see you next time.